therapy isn't just about improving subjective well-being. It's about questioning reality for me. It's about like, what is my reality? How do I want to engage with my reality? And if you see the dots with the links between the dots as one version of reality, and you remove the links and you're like, how many other versions of reality can I create for myself? That to me is where the freedom lies.
You have found the Thinking Mind podcast.
Thanks so much for coming on the podcast.
Well, thank you for having me. It's an absolute pleasure.
Maybe listeners should know that we met in a social context, found out we work at the same place. We're both interested in psychology, psychotherapy. We had a conversation about tribalism within psychotherapy and more broadly than that. You know, how it could be quite seductive, but then obviously how it could be quite dangerous. And I think we should talk about all that. But maybe first you can tell listeners, you know, a bit about your background, who you are, what you're interested in.
Sure. So I guess my background in terms of psychology, I trained in counselling psychology at the University of Surrey. And I guess the reason that this topic is particularly interesting for me, and which will be maybe relevant to the podcast, is that I was trained in a way that kind of embraced different models, and we were expected to sit with the tension of different models of therapy, so to speak. So I sort of finished my training with a particular understanding of therapy, of psychology, and my understanding was that there are all these different amazing models. But what I found, and my understanding is that certain models seem to be prioritized over others. So I guess that's kind of where I'm coming at right now in this moment. And yes, I have different interests in terms of different therapy models, how they get applied in context, the concept even of kind of an evidence base. I mean, that's such a buzzword nowadays. You know, what constitutes the evidence, what doesn't, what is good evidence, what isn't good evidence, and all of that really ties into this in my mind in terms of models that have more evidence than others, so to speak, in inverted commas, I guess. How about you? What sort of got your interest in this? I know we briefly spoke about it in the park, but yeah.
Yeah, I mean, my interest in tribalism, I suppose, stems from the fact that it's clearly more of a problem broadly in the culture, in our society. But then once you recognize it at all, you start to see it everywhere. And I've been fortunate in my psychiatric training to the extent that I did training in psychotherapy. I got exposure to a number of different models. And, you know, before I ever did psychotherapy, I thought of psychotherapists as these highly self-aware, mature individuals. And to a large extent, they are. But I was startled to find quite a high degree of tribal thinking, even within those spheres. So I would see, you know, I'd get exposed to one school of thought, say psychoanalysis, and listen to the way they talk about other schools of thought. And then go to those other schools of thought, you know, CBT, DBT, humanistic, you name it. And it does seem to be a piece of software, this tribalism, that's so ubiquitous within our minds, probably for evolutionary reasons, I can imagine. But now we're just at a point where it's becoming far too problematic. We're not in these close nested tribes anymore, I think, where we can overcome our differences through close exposure. Instead, we're kind of in an atomized society. We're kind of pseudo-connected in that it's very easy to make superficial or shallow connections, very hard to make deep connections. And I think everyone is starting to feel alienated from everyone else. That was quite a digression. All that to say, it's a problem when you commit to your school of thought and when you commit excessively and you don't have the humility to see the value of other schools of thought.
So many good points. I could have picked up any of your points in that segment there and gone off in so many directions. And what do you make of that? Because I guess the words that come to mind for me are almost survival of the fittest. And I don't know whether that's what you were talking about when you spoke about kind of, well, maybe made reference to kind of evolution and tribalism. Is that where you were coming from?
Yeah, no, not necessarily survival of the fittest. I guess what I mean is it was probably evolutionarily adaptive at some point to have some sort of easy in-group, out-group mechanism. Now, you would have thought, I guess, if you were studying humanity from afar, that it would be, we would decide who is in our group and out of our group through more obvious means, like who's in our family, for instance, who's in our literal blood tribe. But what's remarkable is that we've also been able to make this in-group, out-group distinction along ideological lines very quickly and easily. And there are many historical examples, of course, like communism comes to mind, anti-communism, Nazism, all of these regimes based on ideological commitments. And again, sort of once you see it in these big historical examples where it's quite obvious what the danger is, it becomes easier to see even in the everyday. Let me give you an example. I was in a meeting, a DBT meeting once, so dialectical behavior therapy, and I was just trying to speak, to get my point across, and unbeknownst to me, I may have used some psychoanalytic language. I think I made reference to the unconscious or defenses or something, and whoever I was talking to told me I needed to stop talking, that was not DBT language. And, this isn't to deride that person, but it just strikes me as that's an over commitment to a particular school of thought, in this case, DBT, which, I'm a big fan of. But once you close your mind to that extent, once you shut yourself down to new perspectives, I think you're going awry, because the one thing we know about life is that life continually throws you an unpredictable set of problems, and therefore I think you need an equally spontaneous and flexible set of solutions. And it's very unlikely that any given school of thought or ideology can cover that.
Yeah, that's a really interesting point. And I guess what that makes me think of is that, for me, tribalism is fundamentally about what we do with someone that represents an other in our mind, or an idea that is an other compared to our own ideas. And that's such a good example, kind of what happens on a language level when there are two conflicting understandings of the same phenomenon. And certainly, I would ask, and I wonder, what would it look like to have a meeting in which everyone is sharing perspectives, and no perspective is kind of given more weight than any other, or any kind of priority? Like, what would it look like to attend a meeting where everyone's view is potentially valid?
Yeah. I mean, everyone's view is valid, right? And maybe the function of such a forum could be to test out the ideas in real time. That's one of the things I like about podcasting, is it is a conversation where hopefully, I think if a conversation is done properly, you're different after the conversation than before. So you've allowed, you're open enough to allow perhaps some flexibility. Maybe after we talk, I'll come away with some different notions about things, and perhaps you will too. And that's something organic. So in a forum for psychotherapy, I think something similar could happen. I think this is very common in philosophy, where you have debates, not even debates, dialogues, kind of a dialectical approach to test out your ideas. This is what Socrates did in Athens. And I think he made fools of a lot of people in doing so. And ultimately that didn't end well for him. But that was his approach. That's why I guess the Socratic method comes from, of, rather than, if you say something I disagree with, I could deal with that in a number of ways. I could violently disagree with you. I could attack your character, or I could just ask you questions, right? And get to the bottom of why it is you believe the thing that you believe. Who knows? having asked those questions, I may be much more convinced of your position, or I may not. And you being put in a position where you have to explain your position, you might modify your opinion, and that's the power of language and conversation, I think.
Yeah, that's interesting. And when you were speaking about how you could respond to people's views that are based on like different theories, so the example of the DBT versus using psychoanalytic language, for example, and there are all these different ways of responding. And one thing that I've noticed a lot is that one of those ways of responding has now become, there's less evidence for that, or the kind of that science and kind of the evidence base becomes a way of discrediting ideas that don't fit that particular paradigm, which I find really interesting. And another thing was even you just now, and the language that you were using, you moved from debate to dialogue. And it's interesting that the first word that comes to mind is often something more confrontational like a debate, as opposed to something more open like a conversation.
I mean, debates are a problem because the debates are very different. The premise of a debate is that I have my position, you have a position, and one of us is going to win.
Exactly.
Yeah, and that's not a good objective of a conversation. Hopefully the objective of a conversation is to approximate some level of truth collaboratively, which is very, very different. I think on your point about science, I think I agree to an extent. It's complicated. Science, obviously, giving the devil its due, is one of the most powerful mechanisms we have to come at some kind of objective truth. There's no getting around that. But there are problems, especially when applied to things which are quite abstract, like psychology and therapy. The mystery of the human psyche. I think a lot of it comes down to the fact that things are very hard to study. Things in those fields are very hard to study and to fit in to the scientific method. And then that raises pertinent questions about, whether treatment is evidence-based or not. So some treatments are simply easier to study in a scientific context, like cognitive behavior therapy, than others, like, for example, psychoanalysis.
Yeah, absolutely. And it kind of raises the question of, are these disciplines even comparable, really, given that they make different assumptions about the nature of, pathology or the mind or whatever? Because the question that then comes to mind for me is, how do you define therapy? Like, what is...
Let's do that.
Yeah, like, what is therapy for you?
I mean, I could refer listeners to a short clip I did a few months ago called Psychotherapy and How to Think About It. I think even since then, my views have probably changed somewhat. But I think the kind of fundamental axioms I think of therapy are, firstly, to improve one's self-awareness. And then secondly, and this is obviously very oversimplified, to use that enhanced self-awareness to try and improve one's quality of life, however one chooses to define that. And I think it's key that the client decides what's important, that you're going by the client's value system. Not that the therapist's value system isn't involved, because clearly it is. And we live in a society with, to a large degree, quite shared values, even though it doesn't always feel like that. I think those are broadly the two main points: self-awareness and then to improve quality of life.
Yeah, that's really interesting, because I was thinking, wow, that is an interesting perspective, and I was wondering, what would it be for me? Because I noticed immediately I had a response of, wow, that feels quite different to how I think about therapy. And then it made me think, what happens when you're in the room with a client and the client has a different idea about what therapy is and what therapy should be, and you might be going into it with a particular perspective and they're coming into it with a different perspective, and then what happens in that particular interaction? It's almost like a philosophical difference, or a difference in... And then so my view of therapy is that it's fundamentally a meeting between two or more, I guess, people, and that it's almost more, in my mind, a conversation about anything that the client brings, really. And that could, and because I guess people might want therapy for different things, like for self-awareness, for example, or now the trend is wanting tools and techniques in order to manage emotions and distress. And at one point it was to understand unconscious processes. And I feel like the way that we understand therapy has really shifted, but what stayed consistent in my mind is that it's always still been just a meeting between two people. It's just that the frame has changed and the expectations have changed, maybe.
So you're focusing very much on the relational aspect.
Yeah.
And I think that's the part that I don't emphasize enough in my thinking about it. In fact, I'm not surprised, because I think you have much more experience actually being a therapist than I do, given that that's sort of your primary qualification. But yes, I think the relational aspect is really important. We're a very social, animal, and there's something about relationships that's unquestionably healing for us, even if specific solutions aren't presented. There is something profoundly beneficial about being accepted.
Yeah, absolutely. I definitely do hold that view. But it's interesting because my response to your understanding of therapy was one of, wow, that's really interesting, because I often don't think about therapy in that way, but what would it mean for me to think about it in that way as well as the way that I think about it? So it's almost like there's a relational element to it, but other than providing a relationship, yes, it is, you're right. It's about, in my mind, self-awareness. It's about, with that awareness, you can make better choices and you can do all sorts of things that maybe without that awareness are less available. But it is interesting that the shift in focus, and sometimes I think with certain therapies anyway, some are much more relational than others. I mean, I think of psychoanalysis versus kind of maybe sort of really short-term CBT, because I think, CBT can be very relational, particularly in secondary care services where the focus is often on relational problems. But in kind of short-term therapies, the focus is so different, and then the function of therapy becomes less about a relationship than about changing a symptom or changing something that's observable and measurable.
Yeah, I think in a therapy like CBT, the relational aspect is more implicit. It's not, on the tin, if you like. What's on the tin is CBT, cognitive behavior therapy. You're going to learn about your thoughts and your emotions and maybe the way that you're thinking about things in a manner that's not very helpful. But just by virtue of being in the room with someone who's kind to you, someone who's helpful, someone who's not particularly judgmental, the relational aspect will come in anyway. And then, as you say, there are some therapies which are more overtly relational, like long-term psychoanalysis or person-centered.
So I guess in my experience, a lot of the ways that we kind of decide who gets what kind of therapy are often based on presenting difficulties, which is a particular way of looking at it. And I guess it makes assumptions about the function of therapy, which would be supposedly to change those presenting difficulties. But what happens when you've got a client that doesn't actually see their problems as presenting difficulties and sees and would find benefit in just being able to explore?
Well, I think, firstly, I don't think presenting difficulties are a very good way of deciding which model of therapy is appropriate, because, Freud thought about therapy like archaeology, and I really agree. I think it's a very potent analogy. The presenting difficulty is just, however the deeper problem happens to manifest itself on the surface, and very different deep level problems can manifest themselves in similar ways, like, for example, panic attacks, right? But one person can be having a panic attack because they're having a bit of an existential crisis, Another person can be having a panic attack because they're drinking too much alcohol and they're trying to cut down, and maybe they drink too much alcohol because they're in an unhappy marriage. So very different problems presenting similarly. My experience, I think the best way to decide the model of therapy is actually personality and temperament.
That's interesting.
Yeah, so I think about like the big five model of personality. So for example, someone who's high in trait openness, who's therefore very interested in ideas and depth, they might be more suitable for a more, depth psychotherapy, like, humanistic or psychoanalysis, whereas someone who's very concrete, lower in openness, might be more useful for something more concrete like CBT. That's just one example, but, there's a lot.
I would tend to agree for sure. That kind of reminded me that I agree, because if I use myself as an example for a moment, I'm someone who thrives under conditions where I'm allowed to kind of just think without needing to kind of structure my thought too much. I've always been like that. And so I imagine for me being offered a therapy that doesn't quite fit with the way that I think about things, not only things, but also myself and also my style of thinking. Would I be labelled as treatment resistant from a CBT perspective, but not maybe from a psychodynamic or a person-centered, it's...
Yeah, I mean, I don't think you can even use a phrase like treatment resistant in therapy. Treatment resistant should really be applied to medicines and drugs. I think it makes sense in that context to a degree. Even then, you can run into trouble depending on what kind of drug you're talking about or what kind of condition. But treatment resistance sounds like a blunt tool, in that context. It might be that they're not ready to change. It might be that it's the wrong model, but we're, what that phrase, it's emblematic of just how we're trying to medicalize this process of psychotherapy. And I guess you have to, if you're going to offer it in the NHS to a degree, but it's almost, sometimes it feels like we're playing a game of pretend. And the game is like, let's pretend that therapy is like medicine. And it's not, it's different. It's sometimes it can resemble a medical treatment, but, at the other end of the spectrum, it's almost like a philosophical endeavor, depending on the person.
Absolutely. And it is very medical. And yeah, that language is it's surprising and not surprising at the same time. And it tells me how much my own kind of development in the system has shaped kind of the language that I choose as well. I guess I'm sort of thinking, what would a system look like that was less medical? And is the medicalization necessarily just because it's the NHS, or does it exist within a wider context that has resulted in a need to medicalize? Like, I don't know, what's your sense? What's your understanding of that?
I'm not sure. I think I mostly have experience within the NHS. I kind of just think, what ends up happening in a system, and very much the words that the system uses are reflective of the underlying philosophy of that system. So in the case of the NHS, obviously the philosophy is around very much a medical model of illness and treatment, or even possibly cure, depending on the condition. And so you fall into the pattern of using that jargon, even in situations where it doesn't really apply. And really, even in physical health, I think the medical model is starting to apply less and less. And I think about some of the most prevalent medical problems, quote unquote medical problems in our society, like obesity, diabetes, metabolic syndrome, which we classically think of as diseases. We're learning more and more that these are problems of lifestyle that can be very straightforwardly prevented, and largely a problem of the food environment, for instance, that we find ourselves in. Therefore, thinking about it as a disease that kind of happens to you, that's almost inevitable, that requires a medical treatment, is starting to look more and more archaic within the circles of endocrinology. So fundamentally, I think it's about, let's question, what is it that we're trying to do and why? What's our philosophy? This gets back to tribalism. So, everyone's going to have a perspective about how to address a certain problem. Can we meet and discuss and actually change our underlying software that's affecting things on the more surface level? And I think that we can.
Yeah, and I guess it makes me think of, what are the tribalistic ideas between the different models? I mean, if I put my mind into the mind of a CBT therapist, or, I mean, that's a gross generalization, but I guess what are the critiques? I mean, the critiques in my mind are, CBT will critique maybe psychoanalysis as being it's not evidence-based, it's too long-term, it isn't active enough, change doesn't happen on its own. Like, those are the key things that seem to be used as a way of kind of maybe denigrating. I don't know if that word is too strong.
Let's say critiquing, and I would say, to add to those, they might say that it's cumbersome and it's not practical enough, and it's not as goal-oriented enough.
Whereas on the flip side, psychoanalysis tends to say that CBT is too surface level, that it makes assumptions that we're rational, when from a psychoanalytic perspective, we're fundamentally irrational, arguably. So from a psychoanalytic perspective, maybe CBT sees us, or CBT it kind of ignores the unconscious. It makes us all seem like these rational beings, and so it kind of maybe critiques it and then says that it's maybe too surface level. But I almost think that in that debate, we end up missing the point that they just come from different perspectives.
Yeah, I mean, I think they're both right.
Exactly. This is like the thing.
Psychoanalysis can be too long and CBT can be too surface level, right? Yeah. Those are both potential problems. Yeah. I think we need to stop thinking about like the way. There are lots of different ways. Again, and this is why you have to fit the model to the client, and not the other way around. There are clearly situations in which a psychoanalytic method, take the example, is going to be more effective if the person is likely to be less self-aware, more unconscious processes going on, maybe more defended. They have a lot of ego defenses. Then psychoanalysis could be incredibly helpful. If they're already quite self-aware, perhaps, maybe I'm thinking about someone who's quite anxious, they've thought about themselves a lot, but they're not so clear on their how their mental processes affect each other, how emotions, thinking and behavior spiral into each other in not productive ways. And CBT could be really helpful. There's this economist named Thomas Sowell. I don't know if you ever come across him. He's a really interesting guy. And one of the things he says is there are no solutions, there are just trade-offs. And I think about that more and more. And that's, you have to pick your poison a lot of the time. And you don't be seduced by the idea that a particular way you've chosen in a particular time is the way or the truth. It's just a way, and you might discard it at some point.
That's really nice, and absolutely, it is just a way of thinking about something. It reminds me of a certain strand of philosophy and kind of postmodernism and post-structuralism, and I can't remember who said this, whether it was Deleuze or French guy, but he spoke about kind of truth in that what makes something useful. So in this example, what makes a model useful? In today's day and age, we might see it as, well, if the evidence is there, then we can back that it's a useful thing, or something like that along those lines. But he would say, well, if it helps someone, it's useful.
Yeah, if it improves their subjective experience. And I can't help but be, anchored to that. Like, that's what I'm interested in therapy is, can I improve someone's subjective experience in life? If I can do that and measure it objectively, so much the better. I suppose a critic might say, might start talking about things like the placebo effect and, you can improve someone's subjective experience temporarily, but there's also the other side of that coin is you can improve someone's subjective experience of life importantly, significantly, profoundly, just not in a way that's measurable, that doesn't show up on a questionnaire.
Absolutely.
Necessarily. And I think that therein lies the problem.
Yes, definitely. So there's the issue of measurement in today's current approach to what models dominate the field, and does that inevitably, and there's the issue of funding as well. You know, often something that gets used is that other models have less evidence, but a lack of evidence doesn't mean it's ineffective. It just means that the research hasn't been done, and often the research has been funded by organizations that, you know, no one wants to fund a 3-year analysis. It's a lot easier to fund, 6 sessions of CBT or whatever it is. And so that's what that makes me think of. And, you know, is the fact that we're looking to measure distress inevitably going to disadvantage certain modalities or certain therapies that can't make the cut, just simply because on a philosophical level, they don't understand the mind in the same way? So for psychoanalysis, it's less about reducing a core from a 4 to a 3 or a 4 to a 2, and it's more about improving the core being the questionnaire that we often give our patients. And it's more about improving ego function, for example, which is not measurable. And so to me, it seems like it's an unfair way of approaching this because it inherently others certain models.
Yeah, and you'd also have to devise, different research infrastructure, different kinds of questionnaires that measure different things. I was reading a book by Maudsley recently. What was that called? I'm going to add it in post. I was reading a book by Maudsley recently, and he seemed to do quite a lot of research, and he was, coming up with humanistic psychology at the time, essentially. And he was doing research on some quite profound aspects of therapy, like concepts around self-actualization, peak experiences, how to make the most of one's potential. So I think if you're able to devise a new infrastructure to study these things, it can happen. It's not the path of least resistance.
Yes, and in a sense that brings us back to philosophy, and it brings us back to truth, and it brings us back to how you measure truth as well. And it's not the path of least resistance, and particularly because we both work in a medical system that has a very specific way of understanding health as something that is measurable somewhat. So it does make me wonder, where does this, where is it going? Where are we going? Is it going to get more and more kind of uniform in the way that we approach models, or is there room for us to begin to kind of expand a little bit and sort of take a step back and question and critique? Or it does make me wonder where we're going.
I think it's important to point out, of course, that the majority of psychotherapy, at least in the UK, is not happening in the NHS, right? It's a tiny minority that's happening in the NHS. The rest is happening, of course, in the private sector, and then to some degrees in the charity sector. And I think people will ultimately be led by what we were talking about earlier, their subjective improved experience. So I don't even think it's this sort of medicalization is likely to be a problem that affects the field of psychotherapy that widely. And I think psychotherapy as a field attracts people who are sufficiently interested in ideas that it won't go that way. I think what's important is to create a culture within psychotherapy of dialogue and also of profound humility and detachment from one's ideas. Like, think about ideas. The ideas that you hold about anything is a set of tools. And if a better idea comes along, you have to discard the one you have. There are vehicles to get from A to B, I think, especially in something so abstract like psychology.
And I guess that makes me sort of ask the question of how do you decide what idea is better
Yeah.
in that kind of conversation. What do we draw on to make that conclusion?
Mm-hmm. That's a good question. I want to turn that question back around with you.
In my mind, it could be that we are taking an ethical stance that means that we are prioritizing the client as opposed to the science, for example,
or the ideological commitment,
or the exactly.
The client is the territory.
The client is the territory, exactly. So for me, it's philosophical, but it's an ethical thing, really, isn't it?
It must be, because you're affecting people's lives.
So I guess the question then becomes, so when two people or more people are having a query in their minds about what idea is somehow more useful, so the question then becomes, what will help the client? But then the question is, well, how do you know what helps the client? Because we try and measure that, and we'll say, well, there's an improvement in this score, therefore it must have helped the client. But then is that potentially misleading as well? And so then, how do you know whether you've actually helped the client, so to speak?
I think probably it's important at the beginning of any therapy to kind of talk about what the client is likely to want to get out of it. And this is the pragmatic side of me speaking, who's less interested in depth, although there is that side of me too. The practical side of me wants to know, why are they here beyond the so-called presenting difficulty? What do they want to get out of the therapy process? And then to regularly check in with them about, are those goals the same or have they changed? Because they're likely to change. Someone could come in because, let's say, they need help losing weight. And then in dealing with the weight issue, they realize they might have an issue around shame, for instance. And then the goalposts shift, as they always do whenever we pursue worthwhile or interesting goals, they change and shift with time. Yeah. And that can be quite a startling process, because goals, even unattained goals, are quite comforting in that they give you a structure to nest your behavior in. So it's really important, I think, to create a supportive atmosphere where, as those goals change, you can manage the client's expectations. Say, hey, if your goal is different, that's fine. Let's talk about what the new goal that emerges as the old goal falls away. And then, to the extent that the client feels that they're making progress towards those goals, I think the therapy is successful.
Absolutely. And then what that makes me think of is, all therapists are different, and we all, there might be a bunch of therapists all trained in the same model, but ultimately they're going to practice it very differently. And so it then raises the question of, so for example, I'll get referred someone and I practice in a particular way. Some authors would argue that you need to kind of establish from the get-go whether or not, as a therapist, you can meet that person's goals in the way that they understand their goals needing to be met. So, for example, someone saying, I want tools to regulate my feelings, going to see a psychoanalyst, it would be unethical for the analyst to take them on under those conditions.
If they were going to practice in a purely psychoanalytic way.
Exactly. So then it makes me wonder, within the NHS, when there's maybe less choice in terms, not that there's less choice in terms of models, because there is some flexibility there. It's not but if someone gets allocated someone from a particular model, but the client's goals don't quite match the position of the model, then what?
Mm-hmm. I mean, I think as a rule, therapists in the NHS should be quite flexible, but I don't know if that's a controversial thing to say or not. It just strikes me that, again, because we allocate patients based on presenting difficulties, and because the NHS is a frontline service, you're seeing people often who have no other choice. They probably are accessing therapy in the NHS because they can't access it privately, because if they could access it privately, they would, because it gives them a superior amount of choice and flexibility and all those things. And so I think it behooves a therapist in that setting to be as flexible as possible, and to try and meet those needs to the extent that they feel comfortable. If it's too difficult, then I suppose there's always the possibility of referring on or having them see a different therapist. But I think more than unethical, I think if you can't meet a client where they're at, it's not going to be very effective. And then again, they might get labeled as treatment resistant, as we discussed.
Yes, not ready for change, or one of those sentences.
But something I want to ask you, and I guess we probably touched on this to a degree, but if you had to distill what you think is, effective in therapy, however you choose to define it, and irrespective of model, what do you find is particularly effective? How do you know, when you're seeing a client, when you're in the zone?
I think that it varies and it changes. And I think there are different ways that you could be in the zone, so to speak. I think a lot of my training was psychodynamic. So I think like that quite a bit. And when
do you think like that because of your training, because of your personality, or both, do you think?
Very good question. Both. I've always been someone who has made links between things, whether they're real or not, it doesn't matter. I've just always had a part of me that has naturally tended to do that. And that's probably, arguably, why maybe psychoanalysis is a discipline that I find very appealing. It appeals to that part of me. So I think, for example, when I see and when I hear a client begin to make links between things on their own, I think I've kind of done my job in a sense. Arguably from a CBT perspective, maybe not. But in terms of...
But even from a CBT perspective, that would be progress, because CBT is about creating a functional map, really. Sorry, continue.
No. Yeah, no, this is interesting because I guess it's the question of, what is the zone? And I guess for me, I draw on different ideas in my practice. But there's something about being able to step out of one's problem and look at it and think about it. That no matter what model you're working in, all models kind of require that to a certain degree. Even CBT, CBT can't work when people are too stuck in the problem.
Yeah.
There is something of needing, even kind of doing the link between thoughts, emotions, and behaviors requires some distancing.
Some detachment.
Yes,
there's a very marked difference between thinking about your problem and being captured by your problem, because
absolutely,
when you're captured by your problem, you are your problem. You embody your problem. And that's I look at that from a perspective of like mindfulness meditation, where what you're really trying to do is step out of yourself again and again and again. Because the difference between, for example, being sad, you are sad in a particular moment, or being able to step back and view your sadness is very different. And that gap can allow you to do that gap allows for a lot of maneuverability, flexibility.
Flexibility, that's the word for me. I often have this image in this metaphor in my mind. It's an image that I always refer to in any therapy. And I have this image of if you imagine a kind of a bunch of dots on a page, and you imagine that between the dots there is a pre-existing set of links. Some of the dots are linked, some of them aren't linked, and it's just like a snapshot of links, basically. And I draw this metaphor comes from Deleuze and Guattari, who really inspire my thinking, particularly when I was training. And what I see, if I was to kind of metaphorize, I don't know if that's a word, but if I was to do that with therapy, my way of viewing therapy would be that the zone is when you remove the links between the dots and you reestablish what links are possible. Because for me, therapy isn't just about improving subjective well-being. It's about questioning reality for me. It's about like, what is my reality? How do I want to engage with my reality? And if you see the dots with the links between the dots as one version of reality, and you remove the links and you're like, how many other versions of reality can I create for myself? That to me is where the freedom lies.
100%.
Does that make sense?
Yeah. I mean, I think the first thing to recognize is that we, as human beings, don't really see reality as it is. We approximate reality with our perceptual systems through our sight, hearing, touch, etc., and through our thoughts, our psychic processes. We get a glimpse of reality, of what it might be. We kind of get a bit closer and closer depending on how you approach it. But we're always getting a version of reality that's to some extent distorted by our perceptual systems. How do we know this? Because, you can radically alter your perception of reality through lots of means, some involving drugs like psychedelics, but even being completely sober through processes like meditation. So really, everyone's kind of riding around in their own version of reality. And as you say, if you're stuck in a particularly stagnated form of reality that you feel you can never change, then by definition, you can't make progress. And I think that's one of the gifts of therapy, is that ability to realize to what extent you create your own reality without realizing it. And also, and this is more of a psychoanalytic point of view, the secret hidden payoffs to what your reality might be. Or in transactional analysis, they talk about games. So without realizing it, when we're talking to people and interacting with people, we're playing games that are kind of quite scripted, in a sense. So two moms could be talking about their naughty children, and they're playing that game of, we're talking about our naughty children now, and we're getting that kind of unconscious payoff. But there's all sorts of games, and we all play them all the time. So yeah, I think flexibility is so crucial.
Then, because I think that there's a risk with this perspective as well, which there's a risk of assuming and implying that everyone can be just as flexible as everyone else. And I think that there are limitations to that. And I think there are all sorts of kind of social structures that enforce and create particular realities that become very difficult to get out of.
Definitely.
And, what's her name? De Beauvoir, Simone de Beauvoir.
What's her name?
Yeah, what's that woman's name again? Simone de Beauvoir, she talked about freedom, because her and, what's his name? Sarge. He talked all about freedom and choice and responsibility, and she sort of came from the perspective of, yes, but not everyone is that free to choose. Women arguably have less freedom to choose because of patriarchy as a system, which kind of mobilizes a certain reality as well. And the same for all structures, I guess. So it raises, I think there's always a risk of assuming equal capabilities to be flexible.
Yeah. I mean, that's the fundamental problem of the human condition, is we're all constrained. Yeah. We're constrained by society. Obviously, society is a constraining force for good reasons. But it can go wrong, and there's countless examples of that. But we're constrained by our biology. We're constrained by the physics of how the universe works. So constraint is ubiquitous, and I think a lot of life is this like chess game where you're trying to figure out what moves can I make in this particular position that might help me or might help someone else. And obviously, we need to be thoughtful about the chessboard, and what changes can we make to the board to help people actualize their potential as much as possible. I think that's kind of what the direction I think we should be heading. That to a large degree, I think we have, but obviously, these are perpetual problems, and more work needs to be done.
Yeah, and it makes me think that actually, from an existential perspective, freedom is terrifying, and so people stay stuck.
I mean, true freedom is non-existent, right? It's like true freedom is God mode on a first-person shooter video game. And the thing about God mode is, it's unattainable in real life, but it's also not very fun. Like, we evolved to be problem-solving creatures who are continually trying to negotiate obstacles. So, if I talk about life as a chess game, it doesn't necessarily sound super fun, but the truth is that's what engages, I think, our reward systems, is the constant challenge of how do I negotiate this bit of life. It's not always fun, but in a deep sense, it's quite rewarding. And at least in my experience, I've found comfort to be way more terrifying than the right level of challenge. Let's say.
It's interesting that this idea of a chess game, and it makes me think of what you said earlier about transaction analysis and the games people play. And what is tribalism? What kind of game is that?
So tribalism, I think tribalism is when it comes to ideas, ideological tribalism, which is what we're talking about, is when you're overly seduced by a particular pattern of thinking around an area. I think you derive too much comfort and security from that particular system. And so you feel the need to overcommit to it, and then by the same token, denigrate other systems which violate your sense of security and sense of certainty. I think we all have, quite profound certainty needs. We need to have some idea that we're on the right track, that things are going well. But too much of it is a bad thing, probably.
Yeah, and that makes me wonder, what would I need? Because I can't speak for anyone else, but what would I need in order to be able to take in that which is foreign to me, whether that be, in this example, it's an idea. Maybe I've got my pre-existing set of understandings, in the plural, about the world. Under what conditions do I feel safe enough to take things in that aren't from that?
Yeah, you need to be mindful of to what extent are you deriving your sense of security from your ideas. And the more you are, the more vulnerable you are to a tribalistic mentality. So if you conceive of yourself, Julian, as a therapist, let's say you conceive of yourself as a psychoanalyst, and you derive your identity from it, and your self-esteem, and your social structure, and all these rewards, and without realizing it, you're so overcommitted. Anything that threatens that system is going to be threatening to you as an individual. It might even cause unconscious feelings of shame, let's say, or aggression, or all sorts of things. So I think the solution is to realize that you are, valuable and valid as a person, as an entity, irrespective of what ideas you have. And your ideas are just a tool that you're using to try and negotiate with the reality. And as I mentioned earlier, should those ideas start to fail, you should substitute them for better ones.
Yeah, and it this really does bring up for me this question of, way at the beginning when we was beginning to speak about this, I thought of what system is in place around all of this that would be facilitating tribalistic thinking. There is tribalism from the perspective of the model being really very tight knit with maybe someone's sense of identity or beliefs or value and all of that. But I also think I think about the capitalistic structure as well as one that facilitates competition, and not all ideas can equally thrive in a capitalistic system. And I can't help but think, how is that intersecting with all of this on some level?
Would you want all ideas to to thrive, because I do believe there are bad ideas. So I guess I do want competition between ideas. I just want the competition to be framed correctly. So I guess in the case of therapy, that would be, I want different therapeutic ideas to compete as to how they can best improve the quality of lives of people, acknowledging that's no simple question by itself.
Yeah.
But something like that kind of framework, I don't believe that we should treat all ideas as equal, because they're not, in psychotherapy or anywhere else.
Mm-hmm. Mm-hmm. Yeah. What in your mind is a bad idea? What could be a bad...
There are lots of... I think a bad idea is an idea that's seductive, but that ultimately encourages, in an unhealthy sense, the darker aspects of our nature. So really bad ideas are ideas which are obviously tempting, because dangerous ideas rather are ideas which are tempting, because if they weren't tempting, no one would be attracted to them. And I think there are many such historical examples of such ideas. Let's take Nazism, for instance. Really, we have a situation where a whole nation was spellbound by a particular set of philosophical and, to a lesser degree, biological assertions. They were in a very, very vulnerable position as a population. We're talking about the Weimar Republic, with profound economic problems, a desperate people, a people who were humiliated in the aftermath of World War I. And I don't think the role of humiliation in all this should be understated, because I think humiliation is one of the most potent human emotions. And then along comes a very seductive set of ideas that allows for the channeling of these resentments and this aggression in a way that's up too destructive for words.
Do you mean destructive for our clients, for society at large, or?
Yeah, I mean, anyone can be spellbound by a destructive idea. A therapist could, or a client could. And so that's why, to some degree, I'm a kind of... I maintain some objectivity about ethical systems. There are clearly ones that work and ones that don't. And then there's a lot of grey area in between.
Yeah, it's interesting, because I also think that there is something about... Because back to this example that you gave about the DBT meeting and kind of the language used, and there is something interesting, or something that in my experience often happens, is I'll say something using a particular type of language and sort of be expected to say the same thing in a different set of words that would be closer to the model that I'm using.
Yeah, and I think many therapy models they get at the same ideas through a different vocabulary.
Yeah.
Sometimes it's really obvious. Like, a cognitive distortion is quite similar to an ego defense. Maybe not exactly the same, or Gestalt has a set of, mechanisms that are very similar to ego defenses as well. So, and I see the same thing with religion and spirituality. Everyone's trying to get at a particular truth about the best way to live life, and they just have different jargon, because of course they do, because they arose in different civilizations and different times, but we're all playing the same game to a degree. That's the comforting thing about being a human, is that there's a degree of universality, I think.
Absolutely. No, it's a really good point, and I'm glad you sort of mentioned spirituality, because yes, ultimately, arguably, it certainly from a psychological perspective, it's a framework for thinking, or a framework for thinking about the world, as in my mind, every model of therapy is as well.
Precisely. What's your relationship to the unpredictability of life? That's a therapy question, but it's also a religious question. Or what should your relationship be to your own suffering? Again, it's a religious question, but it's also a psychological question.
Absolutely. And ultimately, yes, exactly. And it's interesting how different models will maybe suggest what the relationship to suffering or life should be, existentially, it's all about embracing suffering as an inevitable given.
Yeah. This is always, we always end up on this note at some point.
Yeah.
Podcast is the inevitability of suffering.
Yeah. Yeah.
And what do you think for people who are thinking about studying psychotherapy or who are studying psychotherapy, what do you think is the biggest kind of shift you had as you trained and started working in your thinking?
Since finishing my training and starting to work?
Yeah.
When you say shift, what do you mean?
Something that changed, something that transformed in a way that you couldn't have predicted.
What comes to mind is my kind of finding my comfort in the kind of practitioner that I am. I think when I was training, as I suspect most trainees probably find, is, you know, you're kind of learning the model and you're trying to understand it, you're trying to apply it, and you don't, or I certainly didn't quite yet know who I was as a practitioner before the model that I was delivering. And I think the key thing that I sort of found, I mean, the anxiety of going from training to fully qualified was just astounding.
And what do you think caused that anxiety?
Oh, just the sense of responsibility, the sense of just people just expecting me to know. It's that knowing, it's the certainty that I'm meant to just know. I'm meant to be certain about things.
You're meant to be an expert.
I'm meant to be an expert. The power that's given from being fully qualified from that perspective was terrifying for me anyway. And I still hold a little bit of resistance to that power, because there's a part of me that thinks, well, I can't possibly know. I can think, but to know is a pretty big claim.
And it's probably inappropriate as well, right? Because you kind of learn pretty fast in therapy that you're more of a guide. You know, I always think about Sherpas guiding people up Everest or something. And it's like because there is no real way that you're not like a surgeon can take out someone's appendix, right? They can make that happen to them. A therapist cannot make someone grow psychologically. They can only create a facilitative environment where that can happen.
Yeah, and I think also there's, I don't know, certainly as a trainee, there's the institution of the training institution that has a particular power on the trainee. And now that I'm no longer in that, I think there is much more freedom for me to kind of move around in my own skin as a therapist and establish how I want to appear, what my shape is as a therapist. And I don't think my shape is finished. I think I'm constantly changing. This conversation is changing my shape, and I expect to keep changing. And, you know, does this link back into tribalism? And, you know, does tribalism happen when shapes stop shifting?
Yeah, I think so. I think when they stagnate for whatever reason or other, and I think that could happen for all sorts of reasons. But yeah, I think there's a real value to subjecting yourself to a system for a few years, to a discipline, and it hurts. And it's, you know, I went through medical training, which is not easy. And similar to you, I think I don't like to have my thinking overly structured. But through medical training, I learned to have my thinking be very structured. It's very helpful. But then once you pass through that period of apprenticeship, you're all of a sudden free, like you never were before that period. And then you can really grow in whatever direction, you know, you have a lot more freedom in that respect.
Yeah, and it's making me reflect on my process through training. And I think I mentioned this to you a while ago, but that, you know, my first year was existential and person-centered. My second was psychoanalysis, and my third was CBT. But I did 2 years of psychodynamic, and I remember the transition from one model to the other, which I think is relevant really to this conversation, because moving from person-centered to psychoanalysis, I remember for a good few months I just wasn't buying any of it. I wasn't having any notion of kind of unconscious communications. I was like, nah, you're reading too much into it. But it's because I was coming from a perspective where that kind of thing doesn't exist. And then the same thing happened when I moved into CBT. the part of me that had just kind of almost acculturated myself to psychoanalysis was saying, I'm not taking in this foreign language with these foreign ideas.
That's great. Yeah, that's a great description of cognitive dissonance. And I think that centers around a lot of what we've been talking about, is that very, very uncomfortable feeling of, these ideas which I'm clinging to, and they give me something, and maybe we don't want to, maybe we're not aware that they're giving us something, or we don't want to admit it. As soon as they're being challenged, that very, very specific feeling of, oh, is my world gonna fall apart now, or I have to do this whole process again? But if you just, embrace it, that's what life is. What's the next tool? What's the next idea? I think what makes human beings is we're very, very adaptable. Like a hand can do so many things. Similarly, our minds and the ideas that we come up with and can communicate can serve so many different functions. We're universally adaptable.
But then, when I follow that line of thinking in my mind, I go straight to like issues of funding, of evidence-based practice, of driven by kind of a lack of money, and what happens when there is no funding. It perpetuates a need for a certain type of model, or a certain type of thinking, or a certain way of practicing. So in my mind, the lack of maybe freedom to kind of take in things, it isn't only about identity. I think these things are also maintained by social structures that kind of extend way beyond this in a way.
Yeah, I think that's true. I think that's always been true. And that's why, there's this perpetual cycle of younger people coming in with different ideas, hopefully refreshing other ideas which have stagnated. And I think more than ever before, one thing you can say about the modern world is we've democratized information and its communication. So I don't think, I think that will move us more in the direction of flexibility in the future. I have an optimistic tendency anyway. But I am optimistic about these things. We really live in a world where if you're interested in something, you can find out about it. There's really no excuse anymore. Yeah. And you can communicate it, and you can find other people to talk to about it and develop those ideas. So, yeah, I'm pretty optimistic.
And I guess on the topic of cognitive dissonance, I mean, in your experience of your medical training versus the current training that you're doing, how was that for you? And I mean, I guess you sought out this specific therapy training that you're doing. So there must have been a part of you, I imagine, that was already quite keen. But
I think that I had more cognitive dissonance when I was just doing my medical training, to be honest.
Yeah.
Whereas then now doing therapy training it just feels more aligned with, again, my personality and my temperament. So I often thought in a kind of unstructured way, and I often like to think about myself and how I happen to be the way I am, but also people in my life, how they happen to be the people they are. So there wasn't a huge amount of cognitive dissonance then. I found it very difficult, as I mentioned earlier, to learn how to make my thinking logical, linear and structured. And as much as I found it unpleasant, it's ridiculously useful, to be able to do that, just to negotiate a lot of the problems of everyday life.
Absolutely. So there is something about, yes, being able to see the world through a different lens, maybe through the lens of logic, or the kind of more structure as a lens, really. Yeah.
And if you feel cognitive dissonance, it's important to recognize that's what's happening and to try and realize why, what part of me is being threatened by this idea. And the person you're talking to could still be wrong. It doesn't mean they're right just because you're feeling cognitive dissonance. But just try and think, if I'm having an argument or a discussion with someone and they're saying something and I feel this uncomfortable cognitive dissonance, what ideas might I be overly attached to in this moment? What's the best version of their argument? Because it's easy to make a caricature of someone's argument. That's usually called straw manning. What's the best version of their argument? And therefore, what can I learn from them? And really what this comes down to is the value of disagreement. Disagreement is very important, again, because life's problems are so unpredictable. We could be living together and have very different ideas about how to solve specific problems. And those problems are going to keep coming, and we're going to want to have a kind of brain trust where we try and figure out be as adaptable as possible and have as many different kinds of solutions as possible. That's why there are different kinds of people. That's why some people are conservative, some people are liberal. It's because sometimes you need to be conservative when you're dealing with a problem. Sometimes you need to be liberal. Say you're dealing with coronavirus. In terms of borders, you need to be conservative. You need to close those borders. But say the financial problems caused by coronavirus, you need to be liberal. You need to give people money. It's very, very left, which our conservative government has done. That's just an example.
No, but it's a really good example. And the word that I'm taking away is the idea of a border, and which is so relevant to the topic of tribalism as these kind of enclosed borders of thinking. And, what happens when you open up the borders again and you kind of let things flow a little bit more. And absolutely, you're right. It's, certainly I agree with you that there is so much value in disagreement. I mean, what does a world look like in which everyone agrees with one another? I mean, is that not a kind of utopic?
Yeah. I mean, it's impossible, right?
It's impossible. And yet at the same time, disagreement feels impossible to a lot of people as well.
Right now.
Yeah.
It does. It does. And I think, I don't think we've helped things by being in such agreement.
No, absolutely. Absolutely. And ultimately, I'm just trying to imagine. I mean, what would it be like to be, as a therapist, but even in a meeting, to be talking with someone that agrees with you on every single point, I think would be a really unnerving thing to experience.
I think so. And normally, if I talk to someone and they agree with everything I say, I'm quite suspicious.
Yeah.
It just doesn't feel very congruent.
Yeah.
And I like talking to people when you make contact with disagreement. Some people think disagreement should be the beginning of any negotiation. That if you're going to negotiate with someone, you need to disagree with them as soon as possible in an explicit manner. Because when you're disagreeing, you've reached something tangible you can work from. Whereas if you're pretending to agree with someone, you're both kind of feeling around in the dark, like in relationships. Like you need to have small fights in the beginning to avoid big fights later on. It's very important. Conflict is normally a lot more real than fake agreement.
Speaking from your position as opposed to kind of attributing, I'm just thinking about, I'm getting all therapist-y now, but I'm thinking about, disagreements in personal relationships and particularly romantic relationships, and I guess the value of kind of owning your experience and your thoughts as opposed to kind of claiming a truth that's meant to be accurate for both people or the couple or... Yeah. You know what I mean? So if I think about, a disagreement in a meeting, the difference would be in, rather than saying, this is what's best for the patient, you say, well, from this perspective, this could be helpful for this reason.
Yeah, this is my position at this time.
Yeah.
And try to be very careful about your motivations.
Yes.
I think the psychoanalysis is one strength. It's be skeptical about your motivations because you think you might be motivated. It's easy to feel you're motivated by the most altruistic of reasons, but if you look,
you don't need to look far.
You don't have to look far. You might find that there are other motivational factors.
Yeah.
Well, Julian, listen, I've really enjoyed this.
Yes, same.
This conversation. Is there anything you want to add or ask before we finish?
No, nothing. I feel like that was a really stimulating and interesting conversation, and it's definitely given me a lot of food for thought. And I'm keen to, continue having these conversations with people, really. So thanks for having me.
You're welcome. You're welcome back anytime.
You are listening to the Thinking Mind podcast.
If you enjoyed today's podcast, we'd love it if you share it with a friend, or you could give us a rating on Apple Podcasts, Spotify, or wherever you listen. If you fancy it, you can even buy us a coffee to support the team, and the links for that will be in the show notes. Thanks for listening.